Social connectedness is really important for people's mental health and actually physical well-being. Physiologically speaking, social connectedness actually increases our dopamine, serotonin, and oxytocin, and those chemicals are responsible for feelings of well-being and bonding and love and connectedness. And it helps to lower our cortisol levels. And cortisol is the hormone responsible for stress and inflammation. So physiologically, social connectedness is really important to the body. They've done studies and 50% of adults are lonely. And loneliness is kind of a public health crisis. And in fact, loneliness can almost be the equivalent of smoking 15 cigarettes a day. That's how bad it is for our health. And loneliness is associated with higher risk of illness, such as heart disease, high blood pressure, stroke, anxiety, depression, and it can even increase the risk of premature death by about 26%. And there's several factors as we age that contribute to loneliness. And a lot of that is grief and loss. We're losing our loved ones, we're losing our friends, we lose our spouses. So the people that we used to have these really meaningful connections with are no longer with us. And that's really a big factor in, experiencing some of that loss and loneliness. There's a study done through Hubbard, and it's about an 80-year study on adult development. And what they were studying was the longevity of adults, like adults who live really long, happy, healthy lives. And so they studied all of these measures across the board. And what they found was that adults who have quality relationships and stay very socially connected lived longer, lived healthier lives. And this even beat out the measures of diet, exercise, and sleep. So that's how important social connectedness is. And understand that we're biologically wired for connection. So it's almost like saying, hey, I haven't had water in a while, I'm thirsty. Saying that you're lonely shouldn't be this thing that creates shame, or creates this anxious feeling within us. We should be able to talk about it. So social media can kind of be this way to stay connected to our loved ones, stay connected to people who are far away. But also if there's an overuse or there's too much time spent on it, or the reason why someone's using it isn't healthy, they're engaging in avoidance, we see social media as kind of being more of a detriment to social connectedness. It's reported that about 20% of 13 to 29-year-olds feel lonely, with the biggest chunk of that being our teenagers. And so I think the time spent on the internet and social media is really where we see the issue, not necessarily social media as, I think it's a wonderful tool, but how much time are we spending on that tool and what is it replacing? Here in our community, we have Senior Life Solutions, because loneliness is kind of prevalent in the aging population, and Senior Life Solutions is a program that helps serve the mental health needs of older adults through individual and group therapy and also psychiatric medication management. If you have a loved one that lives alone, stopping in and checking in on them, giving them a phone call, offering them a ride, they need to go somewhere. Those things can be really important to helping our older adults stay connected to the community. Getting connected in your community is really important. So joining a club or a group, getting connected through like a church or volunteer organizations can be beneficial for our health. And I think it's really important that our healthcare providers are aware of loneliness being this public health kind of epidemic that really can impact our emotional and physical well-being. And so if our healthcare providers ask the questions, do you have anybody that you can call if you need something? Do you have friends? What's your day-to-day activity like? How often are you talking with other people? How often do you leave your home? I think if our healthcare workers are better at kind of catching these people that might be struggling with some loneliness, we can help them get connected with resources. Your local social service office will have a ton of resources. Your mental health, behavioral health, churches are a really great resource for connection. Our schools are a great resource for connection. it really is important to stay socially connected.